It could be something that causes strong feelings of distress, and in physical terms, stress can be a pressure or a force applied upon an object or a person. Causes of stress can be internal or external. The external causes may include financial problems, problems at work, problems at home, worries over the political future. Internal causes can be pessimism, negative thoughts, lack of assertiveness, and getting one's ability to voice their opinions or do what they want to do. So stress takes a toll on the body. It can cause problems with the heart, it can increase the heart rate, blood pressure, it can also impair the immune system. And this all needs to poor performance at work or at home. So the direct effects are by increasing the blood pressure and heart rate and decreasing the immune system. The indirect effects of stress and its impact on health include lack of dieting, lack of exercising. Patients who experience stress may be predisposed to smoking, substance abuse, alcohol, excessive alcohol intake. So stress affects the cardiovascular system by increasing the heart rate and blood pressure. This will increase the amount of work the heart does and the demand that the heart has. The heart's going to be asking for more oxygen, more nutrients. And to meet these demands, the body's going to respond. The respiratory rate will increase, and in an effort to bring more oxygen to the lungs and to the rest of the body. But people under stress who have chronic illnesses, especially pulmonary problems, they may not be as likely to take their medication due to the stress. They may not be compliant, and therefore they may be at risk for exacerbations of asthma or COPD. Stress also affects the gastrointestinal system. You can have an increased acid production, changes in gastrointestinal motility or peristalsis. This can exacerbate conditions such as peptic ulcer disease, gastroesophageal reflux, and irritable bowel syndrome. The endocrine system responds remarkably to stress. It produces hormones, which we refer to as the stress hormones. One of them is cortisol. This cortisol can increase blood sugar and blood pressure, hence worsening diabetes and high blood pressure, which can predispose to a heart attack. There's a weakening of the immune system from the cortisol, and it can cause weight gain as well. Stress leads to anxiety, depression. It can exacerbate mental illness, and it can increase the risk of stroke or heart problems, as I mentioned earlier. So, the warning signs and symptoms of stress include cognitive signs, such as impaired memory, difficulty concentrating, difficulty getting tasks done, and seeing only the negative. There are also other signs, such as moodiness, irritability, short-temperedness, feelings overwhelmed, being tired.